Good afternoon, everyone, and welcome to our UK Healthcare Behavioral Health Community of Practice. We're so delighted to have you with us today, and we have a really great set of speakers for our webinar. And thank you all again for joining us, all of our speakers. Today, we're going to be focusing on addressing patient barriers and looking at community resources that are that may be available for our patients and clients with behavioral health needs. I want to let you know today that we are recording this session, and really what the focus today with all of our folks is to provide ideas, because ideas are the fuel for change and innovation. And so we have some providers, some community-based organizations, some state folks, just a real variety of speakers today to try and fuel some ideas that might be of help to you and to your organization. And of course, none of us have the corner on how to do this best, so I really feel like we'll have a great session today. As we go through, we want to encourage everyone who's participating. If you have a question, please use the chat feature, which is right in the middle of your control bar on Zoom. We'd love to hear from you. Just put your questions up in the chat, and whether at the end of a speaker's presentation or at the end of our time today, we'll make sure to try and address those as we can. We're going to launch today, because we'd love to hear from you, a poll to start us off. And so our first poll is going to be, do you have a process for referring patients to community resources? So Mindy's going to activate that poll, and while we're waiting, if you just want to, a screen should pop up in front of you, and if you'll just respond to that poll. All right, and there's so often with our patients and clients with behavioral health needs, they need more than what we can provide just in our healthcare system, for instance. So it looks like most people do have some sort of process for referring to community resources. So let's launch our next poll, Mindy. And really, which resource directories do you use to refer your patients to community-based organizations? So that's our next poll. So we've got kynect, 211. There are a couple of different vendors listed here. Sometimes folks use their own resources. I love the participation. We'll give folks a little bit of time. To respond. Looks like folks are using more of their kind of internally created. So we'll have an example of that today on our directory. Mindy, can folks see our results? Do I need to share them? Are you going to share them? Oh, there we go. Okay, now we can see them. So I realized I should have, on the previous poll, it was about more than 90% of folks on today's webinar have some process for referring patients to community resources. And then here's our results for what the most commonly used platform or method for referring patients to community-based organizations. So not tremendously shocking, but we'll have a little bit about most of these today for us to discuss as well. So thanks for you all participating in that poll. All right, well, we're going to transition over to our speakers today, and it's my pleasure to introduce some folks from King's Daughters. King's Daughters is a partner and part of the UK family now, and today we have with us Amber McComas, who is an ambulatory case manager for KDMC in outpatient behavioral health, and Amber helps ensure patients are admitted with a behavioral health diagnosis, that they're scheduled for follow-up appointments, and provides them with community resources. So she's going to talk about her experience today. We also have Sarah Sansom, who is an ambulatory care manager at the Ashland Family Medicine practice. And she also has a passion for making sure to connect patients with care management resources. And then Alicia Knight, who is also an ambulatory care manager with KDMC. And we are just so delighted to have these ladies here to talk with us about what they do to try and address patient barriers and to make sure that our patients are getting connected to the resources they need. All right, take it away, ladies. Thank you so much.
Hi, this is Alicia with King's Daughters, Ambulatory Care Manager. Are you able to hear me?
Yes, we can now.
Great. Go ahead and go to next slide, please. The CDC does a great job at defining health equity. And achieving health equity is providing people with the opportunity to not just achieve their best possible state of health, but to give them access to the tools they need to manage their health. Next slide. I think this next slide shows a really good example of health equity. While some may not need any assistance or tools to manage their health, others need multiple tools. Like demonstrated in the illustration, the one man needs no assistance to see the ball game, whereas the other two do. Next slide. Joint Commission has made health equity a national patient safety goal that goes into effect on July 1st. Next slide. Here at King's Daughters, we have formed a committee that will be working on the elements to ensure we meet the new goal. One way is to take into consideration the patient's social determinants of health. How equity of access is measured in healthcare often relates to social determinants of health. We can use the social determinants to take into consideration the external factors that affect any given individual's health. Sarah will discuss a little bit more on social determinants. Next slide.
Thank you, Alicia. Hi, I'm Sarah, RN Care Manager with King's Daughters Ashland Family Medicine. Social determinants of health, also known as social drivers of health, are factors or conditions that affect our environments, such as places that we live, we're born, learn, work, play, and worship. Social factors affect, but they do not determine the fate of our health, nor do they destine our future. By identifying these barriers, we improve our quality of life, outcomes, and risks. For example, how can we expect a patient to be able to afford a medication for, say, their blood pressure if they're unable to meet a basic need, such as having adequate nutrition? Next slide. Social determinants of health can be broken down into several areas of concern, such as housing instability, access to transportation needs, utility difficulties, food insecurities, and interpersonal safety. Next slide. Currently, King's Daughters Medical Center screens all patients for social determinants of health. These questions are built into our EMR asking, is the patient able to afford all of their medications and refills? Does the patient have transportation to their healthcare appointments? And does the patient ever find themselves going without food and or utilities because they do not have enough money? Next slide. Social determinants of health can be identified by multiple outlets using screening questions as discussed on the previous slide. During an admission, which a need is identified and a referral is placed to social work and or case management through risk stratification, patient outreach, or simply by patient request. Alicia is now going to speak in regards to the process that the ambulatory case managers use in facilitating identified needs and transitions of care. Next slide.
As an ambulatory care manager in primary care, we have the opportunity to actively partner with the patients and families to provide collaborative care that goes beyond the physical well-being to also include emotional, social, and financial aspects of the patient. The role allows us to develop and coordinate a health and wellness plan that is personalized for the patient. This process also involves coordination of care across multiple healthcare providers and community resources. Next slide. Part of our role is to ensure a smooth transition from inpatient to outpatient. Our goal is to contact the patient within 48 hours of discharge to ensure that they have a follow-up appointment with their PCP within 7 to 14 days. We also ensure that the patient's needs are met so that they are able to manage their health at home. In order to achieve this goal, we may need to collaborate with multiple community resources or specialty providers, which includes behavioral health. Amber, our outpatient behavioral health ambulatory care manager, will speak a little bit more about her role. Next slide, please.
Amber, I think you're muted.
Can you hear me now?
Yes. we
Yes.
can hear you now.
Okay. All right. My name is Amber McComas. I'm the behavioral case manager for King's Daughters Outpatient Behavioral Health. My role as a registered nurse ambulatory case manager in behavioral health is very similar to that of the primary care ambulatory case manager. I follow all patients that have a behavioral health diagnosis or receive a psychiatric consult while in the hospital. All ER and hospital follow-ups are scheduled in the outpatient clinic within 7 days of discharge. We also assist to get referrals in a timely manner. Some examples of outpatient referrals will be therapy, ADHD testing, autism testing, and dyslexia testing. The behavioral case manager also uses motivational interviewing techniques to identify social and emotional needs. Motivational interviewing is a style of communication that is designed to help people find motivation to make positive behavior changes. It allows the patients to be a part of their own care plan. It helps patients to build a good rapport with case managers. Patients are then able to identify their strengths and weaknesses. Then they set their own goals for improvement. Ultimately, this allows patients to take responsibility of their own care. All behavioral case managers at King's Daughters Medical Center are required to obtain their targeted case management certification. This is a 4-part training. The first training is a 12-core curriculum for targeted case management. Then within a year, 3 other trainings must be completed. A 6-hour severe emotional disabilities training in which the primary focus is pediatrics, a 6-hour serious mental illnesses in which the primary focus is geriatrics, and also a 6-hour substance abuse disorder. Next slide, please. The other roles of the behavioral case manager are to complete a needs assessment, which would include behavioral, medical, and physical needs, also to screen for social determinants. Some examples are housing, food, medical bills, prescriptions, and transportation. It's then the case manager's job to provide resources for determinants and barriers. The case manager also keeps a monthly spreadsheet tracking the biggest need for our patient population. Every month, transportation has by far been our biggest need. Next slide, please. Barriers in referring patients to behavioral health services in Eastern Kentucky. One, that locations are not accepting new patients. There's not enough resources, especially for the pediatric population. A shortage of clinics that accept Medicare or Medicaid. That there's long waits for the next available appointment. The average wait for an outpatient behavioral health appointment is 3 to 4 months. Some specialty testing, such as autism testing, can have a wait time of up to 1 year. It is also difficult finding providers that accept commercial insurance. Next slide, please. Some community mental health resources for Eastern Kentucky and Southern Ohio are Pathways, Mountain Comprehensive Care, Regroup, Comprehend Mental Health Services, Shawnee Mental Health, and Community Action Organization. Next slide, please. Some resources that we use for transportation are King's Daughters Van Ministry. This is a free transportation service offered to any King's Daughters facility within a 50-mile radius. It requires a 3 weeks notice and can be scheduled by either the case manager or the patient. We also use city buses. They offer reduced fares of $1.50 to anyone over the age of 62, has a Medicare card, disabled veteran, or children ages 6 to 12. Anyone under the age of 6 can ride for free. They also offer a 10-ride pass for $15 or a 30-ride pass for $45. We also use Medicab. Medicaid insurance covers transportation to and from medical appointments. These require a 3-day notice and can be scheduled by either the case manager or the patient. Next, Sarah is going to talk about community resources for food. Next slide, please.
Thanks, Amber. There are several resources that are available for patients with barriers to nutritious foods. Some examples are Salvation Army, Meals on Wheels, Hillcrest Bruce Missions, and the Community Soup Kitchen. Other resources, such as the neighborhood, serves as a hub to cover many different needs. These include the Ashland Community Kitchen. They serve 3 hot meals a day. The Dressing Room, CARES, Neighbors Helping Neighbors, 55 and Older, and River City Harvest. River City Harvest is an affiliate to Facing Hunger. food bank that's located in Huntington, West Virginia. They have partnered with Feeding America, which is the nation's leading domestic hunger relief charity. Facing Hunger Food Bank is a wonderful resource that's recently partnered with King's Daughters Medical Center that has donated medically indicated food boxes for patients with diagnosis of diabetes, kidney or renal disease, hypertension, and cancer. These boxes are stocked with nutrient-specific foods and materials intended to assist them in managing their illness at no cost. These foods include lean meats, fresh produce, dry goods, and that all align with a low-sodium diet. Next, Alicia is going to discuss some of the resources that we have regarding housing instability. Next slide.
Thanks, Sarah. For housing needs, we have emergency shelters in our area. We are also able to refer the patient to the housing authority within their county to see if they qualify for low-income housing. We can assist patients with application process for those that might need some extra help. We are also able to assist with admissions to skilled nursing facilities. For utilities, those that need utility needs, we are able to refer them to their local community action to see if they qualify for some financial assistance with their payments. Next slide, please. And that concludes our presentation. We would be more than happy to answer any questions that you guys have. Thank you.
We don't have any questions in the chat right now. You all did such a great job in terms of your time. But we really will look forward to having everybody talk a little bit more and ask some questions during our panel session at the end. So thank you all, ladies. That was wonderful. I want to pivot just a little bit, and certainly folks who are listening, I would love to have you offer your questions in the chat as well as we go through. I want to pivot over to Becky Blevins from Ephraim McDowell. Becky has been a member of our REC Kentucky Regional Extension Center family for a number of years, and we've worked with her on a number of things. And she has an example of a community resource guide that they do at Ephraim McDowell. Becky, do you want to talk just a little bit about how you put that together, how your team uses that as well for patient referrals?
Sure. Thanks, Trudy. I really appreciate being able to join this community of practice. And so this all started from the Sentinel event alert that came out from Joint Commission number 65, where we were focusing on the social determinants of health. And so what we realized is that we had a lot of community resources, but we weren't always getting that information out to our patients. And so our team put together this community guide. One of our ladies, Arnetta Myers, has a lot of community resource contacts. And so we started reaching out to our local health departments, our local schools, some of those places that, typically we had not included in these guides, and also our local churches to find what resources were available. And so we put together this guide. We've organized it by county, so that, often that we find some of these patients are very transient. And so unless you can give them the specific resources for that particular county that they may be landing in, that's really the key to being able to help them. And so as we put together this guide, we wanted to keep in mind, it's not just food or, transportation that they need, but sometimes, it may be substance abuse treatment. And we wanted to make sure that we were as inclusive as we could be. So we tried to cover our entire service area. We've made this guide available on our intranet. We've also been distributing this out to many of our partners that we work with that are helping with some of these services. We've distributed to all of our school counselors. We've shared it with New Vista, just all of our community resources that we feel could use this. And our next goal is to actually do some printing of the guide and share that with some of the local churches so that that information would be available for a patient that may not be in the healthcare system yet, but needs assistance.
Mm-hmm. It takes that whole community, doesn't it, to work together to help folks with specific needs. How do you keep your guide updated, Becky?
So from this group, we too have a team that works specifically on social determinants of health. We've also included our marketing resources. And so it's a team effort, obviously, to keep this updated. And so we have assignments for each team member, and they will reach out, on a monthly basis just to see if there are any additional resources that have become available, phone numbers change, that sort of thing. And then our marketing department will actually make those final changes. But it does take a team effort to keep all of this updated.
Absolutely. And so one of our individuals in the chat asked if we could send out links. We will let folks know that the recording of today's webinar, all the slides, as well as Becky's guide and additional resources that the King's Daughters team and others, NAMI, who are on today, are folks from KHIE. All the resources will be available on our community of practice site. So we want to know that you won't have to take a picture or write it down really quick. It's going to be available to you, and then we'll send it out to folks after today's community of practice. So thanks, Becky, for sharing. I really appreciate that.
Thank
In
you.
the interest of time, we're going to pivot over to our next set of presenters. We have folks from the Kentucky Health Information Exchange to talk about how KHIE is helping to enable a connection to community resources using their platform and to help address social determinants of health. I really enjoy getting to introduce Andrew Bledsoe, because Andrew and I have worked together for a long, long time. We were into health IT when health IT wasn't cool. Andrew is the Deputy Executive Director with the Commonwealth of Kentucky of the in the Office of the Inspector General, and serves as State Health IT Coordinator and Deputy Executive Director for the Office of Health Data and Analytics within CHFS, so which is now in the Office of the Inspector General. And then Tracy Williams is Executive Advisor related to Kynect resources. So they're going to talk about KHIE and Kynect and how healthcare provider teams can leverage these resources to make sure that patients can get connected to resources. So thank you so much, Andrew and Tracy, for being with us. Go ahead.
Thank you. I'm glad that the slides went over to Kynect, because I was going to ask that Tracy go first, because I kind of built mine to go after hers. So Tracy.
Absolutely. And thank you for allowing me to talk to you about Kynect resources. And certainly in how we worked with Andrew's team and being able to provide information. So if we want to go ahead to the next slide, I'll jump right in with really an overview of what Kynect Resources is. So what we did is we partnered with United Way and that 211 directory. And so Kynect Resources was built from that partnership as a directory for programs and services and supports that are, throughout the state. What we did is we then also built in the system some tools that can be accessed by users, organizations, if they go through this onboarding process. And of course, onboarding is necessary because we are sharing some information, whether that's some information that we're getting from KHIE or if it's information on a resident, we need to keep that secure. So this onboarding process, though, once that's been completed, there's some tools to be able to manage those referrals, whether you're sending them or receiving them. And it also gives you some metrics on your activity. And then, of course, there is an assessment that helps populate some of those social determinants of health that we've talked about today. As far as like the categories that are available, here are some main categories listed here. Housing, food, those are pretty common. But within each of those, there's so many opportunities for enrichment programs or support groups. And so certainly just a wide variety that has been built into this database. And the reason we built this was we wanted to be able to connect people to help pretty quickly. We wanted to provide some sort of a platform where community organizations could work together and be able to, what I've heard it mentioned earlier about being able to coordinate with other organizations. And it allows a platform to do that. And then, of course, those metrics I mentioned. So I just want to revisit the onboarding process really quickly because there are some steps there, and I'll show you as I wrap up today where you're able to claim your site. That means you go into our system, you say, I'm going to manage this for my organization. There is an account that needs to be created. It's called the Kentucky Online Gateway account. We lovingly call that KHIE. So if you already have a KHIE account, as an example, then you don't have to go through that part. We'll just send you a specific link to give you the role to access Kynect resources. And then, of course, there's some required training. And that training is really just first and foremost, privacy and security, but then some program understanding. We are sharing some information about program enrollments from the state. We're also sharing household composition. And so we want to make sure that we have the privacy and security part there, but then navigation and those programs. So you understand when we're showing CCAP that that's the Child Care Assistance Program that someone may be enrolled in. And then, of course, some navigation training. Also, wanted to point out, and Andrew had mentioned, and I'm sure he's going to talk about this a little bit more, but I mentioned our assessment. We do have a social determinant of health assessment within the system, but we also are sharing that information, those results, with KHIE, and KHIE also shares the social determinant of health information that they may be collecting into our system as well. Next slide. Oh, I am so sorry. I know on the last slide, I'm not seeing the very bottom of it because on the last slide, we can go back really quickly to one. I'm so sorry. So at the very bottom, I don't know if you all can see it. I wanted to mention the closed loop process. So one of the things that we did in our partnership with United Way is, if an organization is working with a resident, they make a referral, we want to make sure that it's closed, meaning that referral has arrived at the organization, that resident received that. We want to be able to track those improved outcomes. So we have a staff of a team with United Way that helps with that outreach, whether that is having community organizations join or if it's outreach to that resident to make sure that they did receive that. We also are able to collect metrics from that we like to share, and I'll share some of those as we go forward as well. Okay, now we can move forward. And I'm going to move quickly. Yeah, this is really our website. It's beautiful, but just a couple of key things. You can search by keyword or category. It is going to sort and filter the results of any search that you conduct by your zip code or address or county or city. You can also see here, you can search by situation. So if I'm unemployed and I go into unemployed, I don't have to go to a job search site and, a utility search site and, maybe a clothing support site. I can have all of that there. Maybe if I'm unemployed, I've lost my health insurance. So in that situation, we're going to generate a list of resources that are relevant to that situation. And then also residents have the ability to take that assessment. Next slide. And I wanted to share who all are users of Kynect resources. So when we have this platform, you see here at the top and center, it's all about the residents. They're able to go to this website. Majority of our referrals are created by residents themselves. There's some really cool things. They can find a listing. They can share that via text or email with a friend or family member. They're able to complete that assessment, and they're also able to have what's called a My Plan. So they can even print out, that plan, or they can, help manage that. Everyone else, our community partners, that's, of course, these organizations that are working and receiving referrals and creating referrals, they too have access to that assessment, but there's some tools there for them to manage that activity and also see some metrics relevant to their organization. Department for Community-Based Services, provider offices, hospitals. We have 10 of our smaller hospitals here in Kentucky that are using Kynect resources. We have other state agencies. Our connectors are folks that help people through health insurance applications. They get a lot of one-on-one time, so they're able to use Kynect resources. And of course, our partnership with United Way has been tremendous. Next slide. And once someone's onboarded, you are given a workspace. So as a community partner who's onboarded, you have this workspace that is like an inbox and an outbox. So those are the received and sent referrals. You have that dashboard, and you can see there on the right side of the screen, it kind of tracks how many referrals you're sending or how many you're closing. Who are you referring to the most? Who's just sending referrals to you the most? And then some statistics there that give you some counts. You also can search for clients. You can build a favorite list. So say you frequently refer to certain organizations, you can just quickly go to your favorites so that you can send several referrals for one individual with one click. And then you also can add staff. So you can add other staff members. If I have an incoming referral, I can assign it to another staff member for them to take care of. And there's no limit on that. Next slide. And once you're onboarded, we do have a consent process for getting to this screen. Now, prior to this, you don't have to go through the consent process to create a referral for a resident at all. You do have to be onboarded, but you don't have to use this you don't have to have their consent to create the referral. But if you do gain a resident's consent that you're working with, we're going to share with you, obviously, their contact information. There's a way to communicate through email, those quick action buttons that's secure. You can create a referral from here. You can start the assessment from here. We're also here in the middle. You can see where we have our household composition information and those enrolled programs I mentioned. You can see when their last assessment was conducted, and those assessments populate those indicators in the social determinant of health that you're seeing there on the right. There's notes. So if you create a referral, you can add a note so that organization that receives it kind of understands a little bit more information about the need. But those indicators also really help prioritize those referrals. When you first log in, you can see immediately where someone may be having issue, and then being able to kind of understand those and work through that with them through that. You can also see referral activity. But certainly once we say work with Amy here in this example, and we're able to get her past this, then we can update that assessment and see those improved results. Next slide. And just quickly, I want to share some metrics. We've had close to 100,000 referrals created in Kynect Resources, almost 14,000 so far this year, and just in the last 30 days, about 3,100. Closing referrals, we have closed so far about 8,280, meaning that outreach has been conducted. We know whether that resident received or was provided the resource or not. We have about 433 organizations who are onboarded. We have a couple thousand to go, but we've had 43 just since the beginning of the year that have joined. We also, in our social determinants of health, you can see we've had almost 6,000 assessments conducted. You can see at the bottom there, we're also able to look at that and follow that through. Are there, the purple is like someone who's critical or vulnerable. The top darker blue is where those are the folks that tested and responded that they're in a critical situation. And then the lighter blue in the bottom of the graph is people who have stability. So we're able to use that data to really understand needs, how they're changing, et cetera, based on those assessments. Please move forward. And if you want to join as a community partner, it's pretty easy. You can go to that Kynect website. At the very bottom of the page, there's a join as a community partner link. You can click get started. There is a video on that get started page that's about 6 minutes long. It walks you through every step of that. And so you're able to follow those steps. There are some steps along the way, but if you go to the next slide, I just want to invite you that if you have questions, if you would like to schedule a session to help with onboarding or anything at all, please reach out to me with Kynect Resources at KHIE.gov.
Okay, I'm going to pick up. Thank you, Tracy. I mean, Tracy really gets to steal the show here because Kynect Resources is so awesome and such a good discovery for many out there. So I'm just going to follow up with a few things. I think many of you probably are familiar with KHIE, Kentucky Health Information Exchange. The only thing I'll say there, if you're not, we connect electronic systems in doctors' offices, hospitals, and healthcare settings from around the state and with other states as well. So if we go to the next slide, what I really want to talk about is how we interact with Kynect resources that you just heard from Tracy. What we know is there is a lot of data around social determinants of health. You're collecting data within your facilities, other healthcare facilities are collecting data, Kynect Resources is collecting data. So we're striving to bridge the two together. And the way that we've done that is we worked with Tracy and Kynect Resources to match against the priority identifiers, SDOH identifiers for the state of Kentucky, so that for every code that you and your or any healthcare facility tracks, whether it be ICD-10 or LOINC, we're going to normalize that or standardize it to the same communication style that Kynect Resources has. So we've matched every single one of those to those 18 priority indicators, and we've given everyone a red, yellow, and green status so that you can easily look to see if there is SDOH information on an individual that you're working with. We'll move ahead 2 slides. Actually, I want to go to the picture. There we go. So this is a glimpse inside of our KHIE clinical portal. This is our ePartner viewer. You can go in here and query for individual patient information. We have a tab called SDOH. This is where we're going to present to you all of the known SDOH information that's out there. So whether that's coming in from a healthcare facility that's been coded, whether that's coming in from Kynect Resources, we present it to you here. On the left-hand side is a macro level view. So everything is aggregated into these identifiers and gives you that red, yellow, and green status. And each individual is logged on the right-hand side. So you can see which ones were most recently provided or submitted and where the source was for that information. So this can help as you all are looking to know more about the patients that you're working with. You can help to understand if somebody else has marked them with as having a social determinant of health, because it's important, like earlier with the transportation, it's important to know if transportation is an issue for the patients that you're working with, if you're going to refer them on to another facility or location. One last thing, there is a little button in the upper right-hand corner called Kynect Resources. So if you are a clinical user of our portal and you see that there's a social determinant of health for a patient that you're working with, you can click that button and it launches Tracy's platform, Kynect Resources, and you can immediately start matching those individuals to the resources that they need. And with that, I think we'll go ahead and move on. Actually, if you want to jump through the rest of these, we don't need these. We don't need these.
Andrew's helping me out here with our time, so we make sure we have enough time for a discussion at the end, and we also have time for our other speakers. Thanks so much, Andrew. That was great. And of course, the slides there are resources for folks after we talk today. Thanks so much for being on. I want to transition to our next speaker, and do please feel free to put questions in the chat. We have Kelly Gunning, who I'm just pleased to introduce her. She's worked for the past 21 years for NAMI of Lexington, and she's co-executive director and director of advocacy and public policy. And she is just such a passionate advocate for mental health. And we're so pleased to have you to talk about how NAMI has resources that can help our provider community as well, and make sure that we're connecting our patients with the best resources. So thank you so much for being with us, Kelly.
Thank you, Trudy. And we can go on to the next slide since you've told everyone who we are. That's great. I do want you to know we have been around since 1985, and our main mission is to provide education, support, and advocacy for persons and anyone whose life is affected by serious mental illness. Next slide, please. Since its inception, NAMI has been having the mission of filling gaps. Most of our folks are very much impacted by social determinants of health, especially in the areas of housing, employment, financially, and just so many ways. We've been a front runner in educating people. That's one of our core things. And we're very strong on peer empowerment and peer programming, community collaboration, cultural competence, scope of services. You guys can read that. Next slide, please. I want you to know that all of our programs are peer driven and peer run and peer offered. So they're also offered with low to no barriers of access. There's never a charge for any NAMI service that happens in the community. These programs are all free to the public. That's a barrier for a lot of people that don't have either the appropriate insurance coverage or they don't have access to some of these things, just basic knowledge about what's happening with their health and their mental health. Next slide, please. As I said, I think it's really important that we educate not only the people that are accessing our services, but the community at large. I don't think things that we've worked so hard on, like replacing Eastern State Hospital, would have ever happened without the 8 years of educating the legislators and the stakeholders as to why we needed a state-of-the-heart mental health hospital when we were so far behind in that area related to the rest of the country. Most of the hospitals weren't 200 years old. So education and advocacy is a huge thing that we do. We do that through educating the families, through all of our support groups. Every single thing we do involves not only the support group, but the education and the advocacy to help those people move along in their continuum of care in the community. Next slide, please. Some of the things that I'm really most proud of are participation station, and this was the state's first peer run and peer driven community resource, and it's co-sponsored with New Vista, who is a community mental health center in our area. But what it is it is the only freestanding service that is run totally and operated by peers, and it's based on the Boston model of recovery. So it's an educational immersion into a community of people who are like you. So this model was taken by the state of Kentucky, and we were asked to take it across the state. So now there are actually a participation station, peer-driven community in every region of the community mental health service areas in the state. And so I'm really proud of that. The QPR suicide prevention is another program we've been able to take statewide. Wellness recovery action planning workshops, those are taken statewide. The warm line takes pressure off of our hotlines in that these are created for people who just need someone to talk to. They just need someone to process their day. They don't have to be in a crisis situation. Isolation and loneliness are a huge part of the experience, unfortunately, of being in the throes of serious mental illness. So this warm line was again created by us and taken across the state for people that they don't have to call a crisis line. It takes pressure off the community mental health centers, crisis lines and hotlines and emergency departments, quite frankly, sometimes. And we're just really excited about that people now have a voice to turn to when they're feeling lonely and just need to process their day. Eastern State Hospital, we're really proud of the fact that we have a peer team that's been operating since the hospital opened. And this is the first that I'm aware of in the state. And also we're being asked to replicate that across state hospitals. So I'm really excited about that, because what we find is people will turn and talk to a peer about their hospital experience and what led to their hospitalization and all of the social determinant of health barriers that they experience in getting to treatment. This is a huge issue, as other people in this have already highlighted those issues with access and transportation and those things. Another thing that I'm really proud of was our intervention into the criminal justice system and mental health, serious mental illness. More and more people were being incarcerated instead of treated. So we started the Fayette County Mental Health Court with Judge Kim Wilkie and Chief Justice Minton 5 years ago. We've served a huge amount of people that would have otherwise just been languishing in jails. This is a huge thing that we need to continue to do. And I would like to believe that as part of NAMI being involved from the lived experience perspective and educating the legal system to what that feels like from our side, to be able to do that now, we have Senate Bill 90. We have a huge focus in our state right now on mental health and restorative justice and how we're going to work with the seriously mentally ill in the judicial system. So I'm really proud of those programs. Next slide, please. These are just some of the results of our, these are specific programming gaps that we found in our community. Young adults had nothing. Once they aged out of the system, there was nothing there for them. So this is groups for people 18 to 35. Double trouble in recovery. We were having people with substance use disorder getting turned away from classic AA and NA groups because they were having to take psychoactive medications. So these are really important gap fillers. Everything we've done in NAMI, quite frankly, has been to fill gaps that existed in the community, either around education, advocacy, or awareness of serious mental illness, which is a social determinant of health. If you have a serious mental illness, you are much more likely to not be able to access programs that are even available, let alone ones that prove elusive. Next, please. I'm trying to go quickly because I know we have a timeline here. I do want to put a shout out there for mental health first aid. NAMI Lexington was one of the first entities in the state who was recognized for bringing mental health first aid with the Department of Behavioral Health and Intellectual Developmental Disabilities. Sorry, I'll get it right there in a minute. So having to have the ability to take mental health first aid will help people understand and therefore circumvent these barriers to gaining health information and accuracy and ultimately receiving the appropriate treatment at the right time in the right place. Next, please. I think that's about it for me. And here is our contact information. I went through that quickly, I know, but I'm trying to be cognizant of our need to exchange more information and answer questions, which I'm happy to do. Thank you very much.
Thank you so much, Kelly. That was fantastic. And we probably should have had you on one of our first ones because we did have mental health first aid training available to folks who were part of our behavioral health community of practice, and had a lot of people participate in that and are just very excited about that. And then here at UK too, just to build on what you said, you know, we feel like as an employer and as a participant in the community, as a health system, we wanted to, you know, make sure that our people are all trained. And so we've had a broad-based training for all UK employees to have question, persuade, refer, that QPR training available so that all of our people know how to ask their loved ones or colleagues, friends, et cetera, if they are thinking about committing suicide. And so that training has been so great. We've had more than 400 employees on UK Healthcare, and then even more UK employees participate at that. So it's been really great. Thank you so much for mentioning those. Other folks may want to avail themselves. So we're going to turn back around and do a panel now with both Kelly, Andrew, Tracy, and then our team from King's Daughters as well. And we did have one question that came up in the chat that was really good from Lindsay that you all may be able to think of or may be able to address and talk about, which is one challenge for substance abuse treatment and transportation is random drug screens. So with needing to schedule transportation in advance, have you been able to operationalize ways to support folks that need to get random drug screens? And so often a condition of employment as well. So any thoughts on that from our panel? Anybody have transportation assistance for individuals that get random drug screens?
I would just like to commiserate with Lindsay, especially because in operating the Fayette County Mental Health Court, we are operating that court as NAMI, not an AOC court. But the problem with random drug screens is that they're random. So you cannot schedule the traditional services. And this is something, Lindsay, we probably need to all put our heads together on and come up with a system, because a bus system is not the answer. Cab vouchers are hard to come by, and it's not deemed a medical necessity to get a random drug test for a court program. So those are huge barriers, and I would welcome working with anyone on solving that problem.
That's great, Kelly. Well, I wonder too, I think as folks work on social determinants of health, as they begin to screen, there's always this tension between how you manage your resources, either as a health system or as a community organization, between folks who have immediate needs versus long-term and complex needs. People who have, getting transportation for someone who needs a transportation to an appointment is one thing, but if they have housing, food insecurity, multiple issues that need to be handled over a long period of time. How do you all, what's the percentage of, of patients that you all are seeing, or clients that have immediate needs, really pressing urgent needs versus long-term needs? And then how do you resource that? Any thoughts on kind of finding a balance between the immediate versus complex needs? Any thoughts? Don't be shy, KD team. I know you probably have some thoughts. You guys deal with folks every day. Okay, let me let's talk about just a little bit then. When you have immediate needs, how do you all then respond to those needs? If someone has immediate like food needs or transportation needs, what are your kind of first go-tos? Oh, Amber, you're on mute. I can see you talking. There
Can you
you
hear
go.
me now?
Yep.
Okay, sorry. I have to mute two places. I apologize. So for immediate needs, like if a patient's with my provider and they have a positive needs assessment, then they come to my office before they even leave the office. So I would provide them with the resources before they even leave. And as far as long-term, that's just why we follow up. So usually if I provide resources to someone at their next follow-up appointment with the provider, they would come in and see me. Because I do something called like a needs assessment where I'll go through all the needs, they'll tell me their goals, I'll see what they're doing to meet their goals, if they've met their goals, what changes we can make, just follow up with them.
How long do you follow up with folks around social needs? Is it variable, I would imagine?
It depends on like how many positives and what their needs were.
Mm-hmm. Okay.
With the target case management, it's a requirement to follow up within 1 month for needs.
Okay.
I'd like to jump in and say, from a Kynect Resources perspective, one of the things that we are currently working on, we are building into the system an urgent indicator. So if someone is making a referral for someone and they've maybe in the assessment or through that conversation have indicated they're in that critical situation, we can have a response to that. So some of those things may actually generate to CHFS programs, but certainly, like if it's not, it's going to a community organization. If that community organization sees that urgency indicator, they can react right away. And of course, we also have the United One group that can help facilitate that. That's not in place yet, but it is a system enhancement that we're working on for the next couple of months. One other thing I wanted to add about Kynect Resources is there is no cost to use Kynect Resources for anyone.
Very important point, Tracy. It's a great free resource to connect across the state, and it is statewide as well. So
Trudy, for us, we have navigators that work in NAMI at our participation station. They're peer navigators, and they work with every single individual that comes in the door. They meet and greet them and sit down with them and do an assessment right off the bat, and then start plugging them into resources immediately. If it becomes an evolving emergent need, then we're right there. We already have familiarity and we're ready to go on to the next step and provide a warm handoff to whatever other community agency or whatever. So the navigators are really huge.
Mm-hmm. That's great. That's great. So what about patients that are are not open to a referral. Like I know that there are some folks who, you know, they'll go through and they'll screen, but then they'll say, but I don't want you necessarily to help me with my resources. Sometimes it's because they have things handled. Other times it's just because there may be shame or other types of, you know, barriers there. How do you all handle someone who has a social need but doesn't want help?
Trudy, for us, this is another big, I think, pitch for peer support. If you're a peer, there's not already a power dynamic in the relationship, so they don't see themselves on a different level. So what's really cool is that the peer experience is, I've been where you are. Let me tell you what I did. Do you think that could be helpful for you? So I think that is unmatched as far as in my experience over.
Yeah, I appreciate that, Kelly, because it can be, you know, you don't want to be in some kind of position to force people, but you also want to be compassionate and supportive. Yeah. You know, that's a big argument as well. I know that we use here at UK community health workers as well. Again, so less that it's on the providers, you know, somebody wearing a white coat in front of a patient where there's that social difference sometimes that can be challenging, so that community health workers with specific training are more like peers and can have those conversations related to connecting folks to resources.
The less intimidating, the more likely they are to trust you and work with you.
Absolutely. Any other thoughts from the panel? So let's talk a little bit about staffing. I know everybody on here is going to say there's never enough staffing or volunteers in Kelly's case to meet every need. So how do you all deploy, you know, what do you feel like, you know, how are you staffed for our provider partners? They'll want to know kind of how many folks do you have that help manage social determinants of health, and then how do you augment that team when needed?
Hi,
You all
it's
have a
Alicia
specific
with King's
ratio?
Daughters.
Go ahead.
Yeah, so here at King's Daughters, every single one of our family care offices is staffed with a case manager. So each one has their own case manager. Then we all work, of course, as a close-knit group too, to where if we are struggling with a patient to find resources, we will, you know, kind of go to our group to discuss it. We also have a social worker, and that is also our support that we can go to, so we can outreach to them too. And I would say the majority of us all have community resources outside of our offices that we've made very close connections with within our community too. So I feel like we have a good support system to kind of lean on for those folks. So we are staffed with an RN case manager in every family care office.
Great. Well, we don't have any other questions in the chat today. I want to just take a moment to say thank you to our speakers. There's been such a rich diversity of information, a lot of different perspectives, a lot of different resources shared here today. We want to point out too that in the slides today, there are a number of resources we want you to know about. Just general social determinants of health resources out there. There's Kynect, 211, Find Help, are free resources available to you. Also related to mental health, NAMI, of course, is a wonderful resource with so many great places to get information. Certainly our community mental health center partners, we've talked about throughout our community of practice. And then we also want to point folks to here at UK. We've been working with our behavioral health team, Lindsay Jasinski, Mark Woods, Andy Cooley, and others, to really build out a set of mental health resources and tip sheets that are just quick, one page, very easy to access information available through our community commitment site. The link is here on the screen. And will continue to build out that site. We have things related to resources related to depression, stress, mindfulness, all kinds of resources like that, and where to get help and as well. So hopefully this has been helpful to you all. We are so thankful to our speakers for sharing their expertise. We're thankful for you all being on the call today. We will be sending out a survey. If we want to go to the next slide, we love to hear from you about what you found helpful with the content. We'll use that to shape resources that we provide after today's webinar. And then we will also use those results as well to shape future resources that UK will be providing as well into the community. So continue to come back as we post, and we'll continue to also provide those out to you. Thank you so much for being on today's webinar, and we hope you have a wonderful day. Thank you all.
Thank